So let's get started. I'm going to deal with what we're calling the 7-month rule that everybody new to Medicare needs to really understand and know about. And so what this 7-month rule has to do with is the first opportunity that people are given to actually sign up for Medicare at 65. Now, I do want to preface, there are some people that are on Medicare prior to 65 because they qualified for Social Security disability. And so anytime someone qualifies for Social Security disability payments, regardless of their age, what happens is once they've received Social Security disability payments for 24 months, on the 25th month, their Medicare A and B begins. They're automatically enrolled on the 25th month. People who have kidney failure or Lou Gehrig's disease actually begin Medicare prior to 65 as well. And so there will be a segment of the population, about 15% of all people on Medicare today, that came into Medicare prior to 65. But those of you that are not on disability, you are going to be eligible for Medicare at 65 as long as you have been paying into the Medicare tax system through FICA taxes or self-employment taxes for at least 10 years. We call those 40 quarters because we can get 4 quarters in a year. So as long as we have 10 years worth of work paid into Medicare taxes, we qualify to receive Medicare benefits at age 65. There are times when people don't have their own 40 quarters, so they can get those either from a spouse or an ex-spouse. If you have questions about how that works, you can put that in the comments, and I'll address that if someone needs to know that. But the point is, we qualify for Medicare at 65 as long as we have 40 quarters. And so our first opportunity to enroll in Medicare at 65 is called our initial enrollment period. We use the acronym IEP. And that IEP lasts 7 months. And those 7 months are tied specifically to your birth month. So let's just suppose someone is turning 65 today. Their birthday is April 18th, 1959. So they turn 65 today. Their 7-month window would be 3 months before this month, April, the month of April, and then 3 months after. So it's always 3 months before, month of your birth month, and then 3 months after that make up that 7 months. Now, there is one exception to that 7-month window, and I want to clarify this. If you happen to be born on the first day of the month, then they actually start your Medicare 1 month prior. So if someone was born April 1, then their effective Medicare month would be March. So it'd be 3 months before March, then the month of March, and then 3 months after. And really the most important thing to know that if we're going to start Medicare at 65, we are going to come in during this 7 months, this initial enrollment period. Now, if you're receiving Social Security benefits already, then you will be automatically enrolled into Medicare A and B, and your Medicare card will be mailed to you just about 2 weeks prior to this 7-month window. And so if someone, again, is born today, their very first month of the 7 would be January, so they would have received their Medicare card in the mail right around December the 15th. And so those on Social Security are always automatically enrolled into Medicare, and again, their card shows up 100 days prior to their birth month. But if we have to self-enroll, that's when these 7 months become very critical. And so what happens is the month that we choose to enroll will determine when Medicare starts our coverage. So again, if my birth month is this month, if I enroll the first 3 months, January, February, March, Medicare begins April 1. But if I enroll during my birth month, they put me off for a month, so I wouldn't start until May. If I enroll in May, they'll start me in June. I enroll in June, they start me in July. And my last month in this example would be July, and they would start me in August. And so I'm just trying to teach you that the month you enroll will determine when they start your coverage. And so it's critical to make sure you enroll at the right time. All right, so that's called the initial enrollment period. Now, the question is, does everyone have to start Medicare at 65 during this initial enrollment period? And the answer is no, they do not. If anyone is still working or their spouse is still working and they are actually covered by an employer-provided plan, they like the plan, the cost of the plan, the coverage, and they're going to continue to work and have that plan available to them as long as that employer has 20 employees on the payroll or more, that person does not have to start Medicare A or B. Let me say it again. So as long as you and your spouse are still working, 20 employees or more, that are at the company, then you're not obligated to do anything with Medicare. Don't have to do A or B, meaning you do not have to use your initial enrollment period. You're fine to stay on the work plan, and then when you decide to get off the plan or retire 2 years later, 5 years later, whatever period, then you will be eligible for another enrollment period, which is called the special enrollment period. Special enrollment period, which is designed for those that didn't start Medicare at 65 because they didn't need to. And Medicare allows you to come in without penalties, without problems, using this SEP. Now, the only difference really between the IEP and SEP is that the SEP, of course, is for those who had work coverage, but also the way it works is it has a period of time that actually lasts 8 months from the time we lose our employer plan. We have 8 months to come into Medicare. Now, even though that's true, I want you to realize that you should never use the eight months. Medicare says you have 8 months, so if someone makes a mistake, they certainly can come in. But the reason we don't use the 8 months is because once we're off employer coverage, then we actually need to start our Medicare benefits really immediately. So let's say I'm 67 and I'm going to retire at the end of this month. I'm done April 30th. I want my Medicare A and B to start May the 1st. Because if I continue on with my work plan through COBRA, COBRA goes to the second payer position. And this is where a lot of people mess up. They are on COBRA because sometimes it's paid for by the employer. But what happens is once you're Medicare eligible, COBRA will never pay in the first payer position. It moves to second payer. So therefore, you have to enroll in a Medicare as soon as you lose your group plan so that Medicare pays first. Because if you do not enroll in a Medicare, then you become the first payer because, again, COBRA will only pay second. And so my whole point in saying that to you is that those people who continue to work past 65, it's fine to come in, but you're not going to use that full 8 months. You'll put yourself in a very risky position, all right? And so this IEP is available for those who have to start at 65. So let me clarify who that is, and then I'll start taking some questions, because there actually are people who must start at 65. And that would be anyone that is presently retired or their spouse is retired, and they're covered by some type of a previous work plan, again, COBRA, but they're no longer working. You have to start Medicare at 65. If you are in COBRA, you start at 65. If you're retired military, same thing applies. You're on TRICARE insurance as a retired military person, but TRICARE will only pay second to Medicare once you are 65. So you have to enroll into Medicare, and then TRICARE pays second, Medicare pays first. Anyone who is still working or their spouse is, and you're covered by a group plan that has 19 employees on the payroll or less, again, you have to start Medicare at 65, which means what? You're going to use this 7-month window. You have to. And then lastly, anyone that's on an ACA plan, Affordable Care Act plan. You went through the healthcare exchange, the marketplace, and got a plan. You are going to come off of that marketplace plan. And the reason you are is because all the financial benefits of the marketplace plans will be eliminated once you hit 65. So technically, you can keep an ACA plan, but you're not going to want to, because once you're 65, you get no tax subsidies. You are going to get no cost sharing by the government. You'll pay full premium, full deductible, full max out of pocket. So those plans are not going to be attractive for you once you're Medicare eligible. So again, we're going on Medicare at 65. So those of you that have to start at 65 must exercise your right to come into Medicare during this 7-month window. So those on retiree plans, ACA plans, employer plans 19 or less, COBRA or TRICARE, you're going on Medicare at 65. So when you enroll determines when they're going to start your coverage. All right, so that's called the initial enrollment period. You don't want to miss that, because if you miss that, then you are stuck with the enrollment period that's called general enrollment period. The problem with that one is there's penalties with it, and you can only use that one the first 3 months of the year. And so our timing could be off on that, and we could be without Medicare for a while, and we don't want that to happen. All right, so that is the 7-month window. So be sure if you have to start at 65, you're doing it during that particular time. All right, that being said, let's start taking some questions. And the first one is this one. It says, by Robert, I turned 65 in March, plan to keep working, stay on my company health plan. Hang on just a second. I lost that question. Oh, on the screen. Sorry about that. I didn't see that. Okay, very good. And larger than 20 employees because I have boys age 19 and 21, plus my wife covers everything I need to do now. Robert, the key to answer your question is as long as there are 20 employees on the payroll, you don't have to do anything now at all. Now, if it's 19 or less, yes, you have to go on Medicare, but 20 or more, and I'm assuming it probably is, you don't have to do a thing. Now, I do want to caution all of you here tonight. In Robert's scenario, what he could do is he could do A only. And not take B. And Robert, you can take A only at 65 as long as you don't have an HSA, health savings account. So if you're contributing to an HSA, I wouldn't do A and certainly would not do B. If you don't have an HSA that you're contributing to, then it's fine to do A only. A only is no cost for most people. A only will be in the second payer position, so it may not pay anything, but it doesn't hurt you to enroll in A only unless you have an HSA. So people that have HSAs and they're going to keep working, or their spouses, I encourage them to do nothing with Medicare. They're not going to be penalized and keep contributing to the HSA because it's such a wonderful tax advantage way to save money for medical expenses. All right. Okay, as a veteran, what do I need to know about Medicare or Medicaid? Okay, well, first off, Medicaid, of course, is a state and federal program. Each state's a little bit different as to the qualifications of Medicaid, but it is almost always low income and low assets. So you can have limited assets, low income to actually qualify for Medicaid. If you do, it's a wonderful thing to have. But unless you're low income, low assets, then the Medicaid is going to be off the table. So when it comes to Medicare, Roland, here's the way it works. And by the way, I served in the Army. I was in the Army National Guard. So if I qualified for VA benefits, I still would enroll in Medicare A and B. You technically don't have to, but if you take A only, Robert, what's going to happen to you is down the road, if the VA changed their system, or you would like to get a civilian hospital or civilian doctors, and you pick up B at a later date, then you're going to be penalized. Because for every 12 months we go without Medicare B when we should have had it or we're eligible for it, we're penalized 10%, and they add that 10% penalty to our Part B premium, and it's a lifetime penalty. So I suggest, as long as you can afford it, I would enroll in A and B for sure. And that way you have all that set up, and then what's going to happen is then from there you can use the Medicare system when you want to, and you're eligible for that because you paid into that system, and then you can use VA when you want to. And so I think that's the best option to do. Another thing that I really like with people who like the VA, people don't like the VA and they're going to get their care, then it's a no-brainer. They'll just do what everyone else does, get a supplemental plan or Advantage plan. But if you do like VA, Robert, what I would do is I would enroll into what is called an MA-only plan. It's called a Medicare Advantage only. And what that means is you don't have any drug coverage in your Medicare Advantage plan because you can get your medications usually at a better cost through the VA system. So we still have a civilian option for inpatient and outpatient. That's the Medicare Advantage only plan. Use VA when you want. Use this civilian option when you want. Just get your meds to the VA. And what happens in that scenario is you'll get some of the perks that Advantage plans offer that are not available to you through the VA. Over-the-counter card, a dental allowance, vision allowance, hearing aids, those kinds of things. But the neatest thing about it is almost always you'll get some type of a Part B reduction. So yes, the Part B is $174.70 this year. It's a month, $174.70 a month. But if you have an MA-only plan, that MA-only company will actually give you a credit towards your Part B. And sometimes we see that $100, $150 a month. So it pulls that Part B premium down quite a bit. And the beauty is, if you don't like that system, you can always come out of it. It's not like it's a lifelong decision for you. You can change that and just go back to VA only. All right, so I hope that helps. You do have a couple options. Frankly, if you like the VA, I think getting a supplemental plan, though I love SUPs, I think it's probably a little bit too much insurance for you. I just probably wouldn't spend the money on that. Okay, when you talk about the earnings test, does that include the money I receive from Social Security? And the answer to that is no. Earnings test is only working wages. Now, for those of you that are familiar with what we're talking about, is this. When someone, sorry about that. When someone begins to take their Social Security benefits prior to their full retirement age, Number one, they take a reduction in benefit, 0.5% per month, which is 6% a year. So if we take Social Security prior to full retirement age, we take a reduction. But secondly, if we decide to take Social Security and we're going to keep working, we can only make so much money. And we actually have a low number and a high number. But for the bulk of that time, from age 62 up until the year you turn full retirement age, you can only make $22,320. That's it. If we make above that, they actually penalize our Social Security check. Now, the year we turn full retirement age, the year we turn, we can make $56,520. So it's a lot more. Now, the month and year we turn, it goes away. So we have no earnings test. So if I'm taking Social Security at my full retirement age, I can keep working. I can make as much money as I want. But if I take prior to that, now I'm going to be subject to the earnings test. But earnings test, what is tested is only working wages, commissions, salary, hourly wages, those kinds of things. No Social Security, no pensions, no distributions from IRAs, no rental income, no investment income will ever be tested. All right, just working wages. Okay, 5, let's switch back to Plan A for 20. Okay, Richard, June of 2024, special enroll to try Advantage Plan. Okay, yes. So if I'm assuming that you're talking about that you're going to turn 65 in June, and if you apply for an in plan from June 2024 all the way through May of 2025, you're in what's called a trial period. And yes, then you could go back. Now, you're not going to be able to in that trial, right? Yeah, you can go back to an in. I just don't know where you live, but most places you would be able to return back to the plan. Worst case scenario, you'd have to go back and pick up a G, but I think you're fine thinking that you can get the in plan back. Okay, I wouldn't do that to save premium, and the reason I wouldn't is because you're still subject to all the Medicare Advantage Plan limitations, the networks, pre-authorizations, those kind of things. I personally never suggest doing that at all. If money is real tight, then maybe, but otherwise I wouldn't do that because you're getting low medical coverage when it comes to Advantage Plans. The insurance is called low medical coverage. High in perks, high in the perks that they offer, but low medical coverage. So I wouldn't do it. My wife and I are exactly a month apart. We turned 65 in mid-January, May and December. Is there an advantage getting supplemental insurance at the same time? Any advantage? Well, here's the thing. If you're no longer working, then you're going to have to start your Medicare in December, and she'll start hers in January. So it's only 1 month difference. And so what's going to happen is I would suggest you choose the same supplemental company because they will give you a household discount because you're both going on Medicare. So that's what I would do. As far as advantage, there's no advantage. So what's going to happen for you is you're going to start your Medicare, unless you're working, you're going Medicare A and B this December. So you're going to want to start your supplemental plan then or your advantage plan then. The household discount would kick in when she goes effective in January. So yeah, you do yours and let her do hers. That's the way I would do that. Do not separate those at all. Okay, that's Center for Part B. Part A, but now I've been laid off in September of 20. No longer have company insurance. Okay, well, Deborah, yeah, you're in a problem because Deborah, you got laid off in September. I'm assuming the company covered you all the way to the end of September. So we've got October, November, December, January, February, March, April, May. Okay, you're almost, Deborah, outside of your SEP, and so yes, ma'am, you do. But your biggest problem right now is that you're other than A, you're going to be responsible for everything on the B side. So if you had a serious health issue, Deborah, you're 100% responsible on the B side, and you have liability on the A side. So you need to sign up for Medicare ASAP. Let me go back to it again. So I said October, November, December, January, February, March, April, May. You can push this if you want up until enrollment of May, but I wouldn't. I'd be enrolling this month into Medicare B. You qualify for an SEP. Your previous employer is going to have to verify that you've had coverage back to 65, and then I would start everything May 1 for sure. You're in a mess if you had a health problem. And that's exactly right. You do have 8 months to sign up, but the problem is, Deborah, you're the first payer. Yeah, you're paying for everything. So again, I said you can push it to May for a June 1 start date, but that is it. But again, that's just a very risky position, especially at our age, okay? What? Okay. Oh, I didn't know that. I'm sorry. Okay, so you took my Social Security at 62, work part-time with company insurance. Do I need to do anything regarding A? Okay, will my company insurance suffice versus Plan B? Well, Angus, if the group, if the employer has 20 or more, then it's fine to do nothing as far as Medicare B goes. But if you took your Social Security early, you're going to be automatically enrolled into Medicare A and B. And so if the employer has 20 employees or more, what you can do is you can actually send the Medicare card back in and they will drop off the Medicare B and you'll have A only. But if the employer has 19 or less, you're not going to do that. You're going to go on Medicare A and B. And again, so company insurance will work if the employer has 20 or more. Okay? But the card will show up, I promise you. It was one of the normal states, even though you can get equivalent plans, do they still work out of state? Absolutely, yeah. All plans that are supplemental plans in nature, whether that's Wisconsin or any other state, will give you federal coverage. As long as that provider takes Medicare, then that supplemental plan is going to follow. Okay, so it's truly federal coverage. Just Wisconsin rules for getting the plans, but it doesn't affect your coverage. You're covered anywhere in the U.S. or U.S. territories. All right, I've barely been on Medicare for a month. At your associate's suggestion, I signed up with Signa. They sold out, so how does that affect me? All right, well, number one, Karen, I didn't realize that the Signa acquisition has even gone through. I know someone is trying to buy Signa right now, for sure. But the company that's buying them is a very reputable company. And so I don't think there's any issue at all. Now, here's the thing. If you're concerned about that, then you're still in that period of time where we can put you on another company plan if you'd like to do that. But Signa, still a good company. Again, the company is trying to buy them is going to be fine. So I don't think you're in a bad position, but if you're worried about it, hey, just call back in. Well, let's just find you another carrier. No problem whatsoever. Okay, and again, I think that merger acquisition is probably going to go through, but again, those companies I think are still going to be very stable with their rates over the long haul. But if you're concerned, please let us find you another carrier. No problem at all. You are welcome. Very much glad to be of help to you. Okay, so Gene, what's dental plan do you suggest? Well, what I would do first off about dental is find out, does your dentist have any kind of a special plan for their patients? Sometimes they do, and sometimes those are very attractive. So that's what I do first. Number two, I'd find out if there's any particular plans that your dentist likes, because it's nice when the dentist will take the plan. If you don't have a dentist yet, and your dentist takes a lot of the plans, then I like a plan. The one I'm on is actually called Emeritus. I like it because in most states it has a $3,000 benefit plus cleaning, so I kind of like that. But again, there's a variety of good dental plans out there. We write some, and so if you want us to help you with that, happy to give you advice. But again, I like a PPO plan. That way you can go anywhere you want. I like a plan that doesn't have a long waiting period, so you have some benefits pretty quickly. And then I like one that's going to offer you about $2,500 to $3,000 annually plus cleanings. All right, so that's what I'd be looking for in a plan. But always be sure to find out about waiting periods. How long before you have the coverage? Yes, it does. And Sharon, sometimes as far as these household discounts, it can be like a significant other, a non-married household domestic partner or something, as long as that person is, some companies, they got to be above 50. Some they got to be above 60, so it just depends on the age of that person. But yes, usually household discounts, you don't have to necessarily be married. You just have to have somebody else in the house that your like you said, boyfriend, could be a sibling with some companies as well. And normally they're going to ask the date of birth and sometimes the last four numbers of the Social Security of that person to verify, who it is. Okay, well, Sham, as long as you're healthy, you can pick up a supplemental plan anytime you want, okay? But if there's someone that has health concerns, then they should always pick up the supplemental plan no later than 6 months of their B date. So if my B date is this month, April 1, I count the 6 months as April, May, June, July, August, September would be the last time I can enroll for an October 1 start date. And if I go beyond that, in most states now, I'm going to have to medically qualify to get that supplemental plan. So we never go beyond 6 months of the B date. You just don't want to take the risk of that. It's not that you're going to be penalized. It's just that you may not be able to get a plan if you have health problems. Happens to my increase. I remember go back to work and drop my Medicare coverage while I'm working again. Okay. Well, if you go back to work and drop Medicare, there will be no IRMAs. Okay, so you don't have to worry about that at all. Once you've dropped, because there is no IRMA on the A. IRMAs only apply on Part B and Part D. So if we go back to work, I would encourage you drop Part B, drop your drug plan, stay on the group plan, and then we have to pay them later. So the way that's going to work, let's say you work 3 more years. So remember, if I'm working in 2027, they're going to look back at 2025 modified adjusted gross income. So they reevaluate the IRMAs every year. So again, they're always looking back 2 years. So that's how that's going to be handled. Okay. Alrighty. If I stay with large company plan at 65, lose coverage due to unexpected disability, is there a scenario where I could not get SUP without underwriting? The only scenario would be is you lose your job, you're going to go on Medicare immediately. The only scenario you would not be able to get it is if you did not pick up that supplemental plan within 6 months of the B date. Okay, so as long as you do that, and you should anyway. So once you know you're going to lose the plan, folks, listen, right now I could start somebody right now on Medicare. Today's April 18th, and we could start them on Medicare May 1st. I can get a supplemental plan effective May 1, a drug plan effective May 1. Now, we may not have our cards, but as long as that application goes in before the end of the month, we can ask for coverage effective May 1st. Okay, you can do it very, very last minute. So I can't see any scenario where you wouldn't get it as long as you took action within 6 months of the B date. All right, that sounds good. Okay, well, folks, thanks so much. Again, we do this every couple weeks, and if you can tell your friends about us, and we can help you as a company, and there's no cost at all for our services, and so we're brokers right everywhere. So just give us a call. We'd be delighted to help you. Thanks so much for joining in tonight. Take care.